Hello, I'm Allie. I am a physical therapist with a pelvic floor specialty. I'm based in Knoxville, Tennessee, where I own Belle Therapy Wellness. Okay, today I just honestly had an inkling that I wanted to talk about this. I want to go over endometriosis because I don't feel like it's very easy to find a nice streamlined source of information. I will tell you right now, I enjoy the Mayo Clinic's little refresher page on this in their website. There's actually even a video by one of their surgical DOs on staff that specializes in surgical treatments for endometriosis. So, highly recommend watching that. I will see if I can link that below, if I can find the link again. But endometriosis. So, I obviously see a lot of women with this in their medical history, even though they come to me and say, hey, I have endometriosis. But typically in my scope, what I treat, what I will work on with people, with women specifically, is painful periods, painful intercourse. Actually, sometimes I have a lot of people, a lot of patients who, struggle to have bowel movements, who, struggle with constipation, struggle with, fully relieving their bladder whenever they go to the bathroom. These can all be side effects from the endometriosis. Or sometimes these can be coming from other sources as well. So it's one of those where you've just got to be aware of your body, be aware of what's going on. But okay, endo. So endometriosis, I think, is vastly underdiagnosed. Now, that is typically because I think as of right now, still today, the formal diagnosis can only be given if you have an exploratory surgery and they go in and they will find the actual tissue. So, endometriosis, the uterus has a lining called the endometrium. Endometriosis is a disorder, a problem, when tissue similar to that of the endometrium grows on the outside of the uterus. So if you think of the uterus organ, the lining of the endometrium is more in the organ itself. So it's when tissue similar to that grows on the outside of the organ. So it can grow on the outside of the uterus, it can go around the fallopian tubes, it can go around the ovaries, and this is where it can occasionally, not always, create scarring. They can create little cysts called endometriomas. And this is where it can start to kind of scar into the bladder, it can scar into the rectum. So you can get some bowel and bladder symptoms of this dysfunction as well. So endometriosis is that. Okay, so it is abnormal growth of endometrial type tissue on the outside of your uterus. That is where you will get severely painful periods, typically in the abdomen. It can also radiate into the pelvic floor, but we're just going to focus in the reproductive organs for right now. That's where sometimes people will even feel back pain. You can get that constipation issue coming from if there's scarring or fibroids and cysts, endometriomas coming out and kind of bumping into the rectum. I feel like I've had two specific cases I can think of where they had an endometrial removal surgery, like an endometriosis clean out surgery. And then they come back to me, let's say a month or two after their surgery, and they're like, I feel so much better. I can go to the bathroom now. I feel great. And it's like, okay, awesome. And then the big issue with endometriosis at this point is that there is no cure for this. There are treatment, there are management techniques, but there is no cure. If you have endometriosis, as long as you have a cycle, so the pain is typically in the cyclic pattern with your menstrual cycle because it's very hormone driven. I could have said that a little bit cleaner, but all of that to say, because that endometriosis is similar tissue to the endometrium of the uterus, well, we know around our cycles, what happens with the female hormone cycles. All of that still plays a role in that tissue, even if it's growing on the outside of your reproductive organs. So that's why around your cycle, you're going to get that pain in specific places. And that's why your periods are probably going to be, a little bit rougher than your peers or your friends. Unfortunately, that's just the nature of the beast of endometriosis. I did hear a really cool research project that they're doing on endometriosis, and that's one of the reasons that spurred this talk is Dr. Stacy Sims. Love her stuff, love her channel. She is an exercise physiologist. She has her PhD. She is incredibly intelligent. Like, I just honestly eat her information up because it is so good. And she is also, she's very research driven. That's why she has her PhD. I mean, this is like the stuff that she does for a living. And that's also one of the reasons why I trust her, and I really, her stuff on social media, her channel, her website, her educational platforms, is because she is very up to date on the most recent things. Okay, so that being said, one of the cool things that I heard on one of her podcast talks is this isn't anything like super in depth, but they are starting to do research in cold plunging for women with endometriosis, because endo is it's an inflammatory disorder, right? Like, your body, like, through this cycle, like, gets a lot of inflammation, is inflammation fed, inflammation causing. So I thought it was really cool, like, the rationale behind this. They were looking at cold plunging as a way to reduce that inflammatory response from the endo. And it's fascinating because I think they're in some like preliminary trials of this, and they have already seen positive results. Now, if you look at Dr. Stacy's, information on cold plunging, like, unless you are training for something very specific, like a triathlon in the Arctic, then the temperature for a cold plunge for women needs to be vastly different than a cold plunge for men. So for women, I think, granted, she's in New Zealand, so she speaks in Celsius. I'm in the United States, in Knoxville, Tennessee, so I'm going to speak in Fahrenheit, but I've heard on a lot of her stuff, typically between 50 to 55 degrees Fahrenheit is what she recommends for a cold plunge. So I think for anyone struggling with endometriosis, this could be a really cool opportunity, because I feel like right now cold plunges are quote unquote really trendy. Sauna, like, heat therapy is awesome, but cold plunging is also like really making its way. So I think if you have endo, this could be a really, honestly, affordable, like, you're not putting another medication in your body, you're not, vastly changing your lifestyle. It's a cold plunge it's very timing based because of the cycle. So if you think about timing, what they're looking at is cold plunging specifically around your ovulation time. And then I need to actually find the article that she's talking about. I would love to read it. But then leading up to your period and through your period. So obviously they're looking at a particular phase of when that endometrial tissue would be having that inflammatory response, building more endometriosis. This is why a lot of times if your OBGYN like knows you have endo, they will typically recommend like IUD or anything that is period stopping, because the more you have those cycles, the more you have your menstrual cycles, the more the endometrial tissue will continue to grow. But sometimes, birth control options are very hard on different people's bodies. And sometimes people also just don't want to mess with the hormones, which I think that is every person's, that's every person's personal decision. That's their right to make. So I think if you want to do the whole natural cycle thing, but you don't want to take any other medications, but you're really tired of your endometriosis and are looking for some way to possibly help stop the growth, I think this research article is really cool. Cold plunging, there's not really any negative side effects. I mean, unless you have like an extreme thermoregulation dysfunction, which obviously consult with your local doctor or your medical professional on whether or not it's right for you. But I thought that was a really cool thing that they are exploring. And I would really encourage you, if you have endometriosis, maybe this would be something that you could explore as well for management and prevention of future growth. So cool. All right. Fun chat. Got to get back to work, but hopefully you found this helpful. And like always, please put comments down below. Let me know if you have any questions or any other things that you would like me to research and provide education on. So have a great rest of your day. Bye.